One thing I want you guys to think about while I'm sharing this information with you is if you've ever done any counseling personally or in any form, think about how um, like the termination process affected you, and whether it was like happy feelings, sad feelings, if it might have triggered like what they call relapse, where you're not fully healed, but it kind of triggered that anxiety of like being left or not being accomplished with the whole session. Um, just because that's good, some of that's going to be brought up in what I'm going to share. So, and even me, like I was, as I was reading the information, I was thinking of some of the different times that I've been through counseling and like the different feelings that I had with either ending it or like right now I'm on what's called standby status with my therapist, just because I work and it's kind of hard to get in to see him with the 8 to 5 work schedule. But yeah, so just kind of think of those feelings that you guys might have had, um, just because it's something that they were talking about. They were saying, I read this article called How We Say Goodbye, Research on Psychotherapy Termination, and it's from the Society for the Advancement of Psychotherapy. And they were saying that termination is viewed by both the therapist, or by therapists, I should say, as a complex stage of psychotherapy. So during this time, the process and progress of psychotherapy are reviewed. They make time to develop goals for the future for the client, and the therapist and client, they say initially they're saying goodbye. They said that with some clients and the therapist, psychotherapy is also theorized to trigger a re-experiencing of past losses and grief. They also said that given strong attachment that can form over the course of a long-term psychotherapy, it is possible that termination may be more complicated and difficult compared to short-term psychotherapy. But they did say they're still running testing on this. They're still trying to really see how it affects in the long term and short term. But they said that there's this termination loss model, and there's 2 points to it. There's termination as crisis, which suggests that clients and psychotherapists experience termination as a difficult process in which symptom relapse is probable. And then there's termination as development, where termination serves as a catalyst for growth, crystallizing the process of psychotherapy and one's personal growth. Um, One thing that struck me as interesting is that they said 69% of clients appreciate the opportunity to discuss their reactions during their review of the therapist and the whole process. And they said that during the survey and reaction, of the reactions to termination, that clients identified as having pride, health, accomplishment, independence. They were cooperative, calmness, alive, agreeable, friendly, good, healthy, thoughtful, and satisfied. So that kind of tells me that a lot of people that go through therapy actually come out with a very positive experience. There's only maybe probably a smaller amount of people that are not very happy with their experience. Um, and they said too that in terms of deciding to mutually terminate, that a lot of the times it's the clients that are initiating the termination, it's not the therapist. So and that these discussions they actually occur about 2/3 of the time. So some of the reasons given were accomplishment of goals, situation or external factors, and for the ones that are not happy, dissatisfaction of the psychotherapy, which they did say that um, there were clients that said that there was a lack of interest. And in a way, it's their way of saying that they weren't happy with the whole process, but they don't want to come out and say that they were not happy, which is kind of interesting because if I'm not happy, I just tell them this is not working. This, I don't want to do this. So we'll go one by one and just kind of share like if we've ended therapy before, like how it's kind of affected us. So I don't know if anybody wants to go first or.
I can go first because I've had experience with that. When I stopped using drugs and stuff, I went into a 6-month rehab, and I was in there with 40 other women, and which was really fun in itself. So we kind of became a community over like the 6 months and stuff, and we did all of our counseling and everything together, and all of our sessions together, and so it was really emotional when we ended it, like when I graduated or ended the program, because it is kind of it's really scary, first of all, because you really haven't been support group and stuff, and it's like you've bonded with all of these people and stuff over the last 6 months, so you're losing your complete community, and it was really it made me feel really insecure, like, because I didn't have that confidence on my own to be able to go ahead and you know, go out into the world and make decisions on my own without like talking it through with this group, or so I thought. So so it was really emotional just because we had bonded so much with one another, but it was a good experience looking back, because that was kind of my graduation into my own freedom and into my own sobriety and my own walk. So it was, it is a pretty cool experience overall. And then I've been in other group therapy sessions before where I really wasn't too dedicated to it. And so it did have less of a like, it's like, let's all clap, we're done, like kind of thing, because I didn't really invest my time or energy into it. And so I've had both experiences where I've been like fully dedicated and not dedicated at all. So I think it really does depend what you put into it.
Okay. Anybody else?
I've been in therapy a lot. So, like in and out since I've been. So I've never had a therapist like terminate I've never been in group therapy. Even when I went to my alcohol rehabilitation class when I was younger, was never into the group therapy. I always felt that no one wanted to hear my problems. So I was always more comfortable in an individualized setting. So, but I've had 3 therapists, and I've ended 2 when it hasn't been real sad, and then 1 where it was my therapist before the one I currently had. She and I still remain in contact. We text, and she was instrumental in changing my life. And I went to a therapist last year for a little bit, but I think I compared her to my last one, who was amazing, and I just never got the same, I don't know, same results, or she wasn't what I had hoped for. She was very cold and very clinical, and that's not something that appeals to me. I need somebody a little bit more empathetic and warm.
So not very good bedside manner in a sense. Like if we're in the nursing world, that's kind of how it would be.
Yeah, so I'm not saying anything bad about this, but she's still doing her supervisory work. So she's very new. And I mean, I get it. We all have to start somewhere. I mean, I'm in the program, so I'm, I maybe understand a little bit more, but it just wasn't. I told my husband that I would like to go back to therapy again, but not to her, just because this transition from where I'm leaving to where I'm going is making me feel a little bit like a failure, like I couldn't cut it. So I'd like to go to somewhere else, but it's tough because I just kind of ended it because I thought, oh, my life's going to be different. And it wasn't. So it wasn't sad for me. I'm the one who chose it, and I'm the one who's chosen it all the other times. Okay. So I guess there was more of a finality to that I didn't feel like I wasn't ready or anything like that. It wasn't like a set time where I felt like Teresa said she knew she was going to be leaving after a certain amount of time. I didn't. I was done when I thought I was done, you know.
Okay. Karen, Bruce?
So, yeah, so I had similar experiences to Lindsay. So I've gone to 2 different therapists in high school, both for eating disorder treatment. The termination with them was not really sad. It was kind of on my terms. I just chose to stop going. But I never did any group sessions. It was all individual sessions.
Okay. Bruce?
Yeah, I'm a pro therapist goer. I'm like sitting here thinking, my goodness, how many therapists have I seen? And I think I've seen in my lifetime 6 different therapists, all ranging from programs to just going to visit until I felt as though I could terminate myself. So I have 2 experiences actually. When I was in my 20s, I went to a counselor for trauma, and he also dealt with rejection and abandonment issues. And that was a year long, like 2 days a week for 1 year therapy. So it was pretty hardcore. It was more psychoanalytical, so we did a lot of deep digging. It was really freaky as we got closer and closer to terminating, because then I started realizing that a lot of the stuff I had learned in my therapy, I had to actually start applying outside of therapy. I was also involved in 12-step recovery at that time as well. So I was pretty fearful about leaving the confines of, I guess in a sense, a controlled environment, to being responsible for my own behaviors and how I reacted to situations. But then fast forward I'm involved with Celebrate Recovery, which is a Christian-based 12-step recovery group. And I've ran, it's a peer-led, so it's not like I ran the group, but we kind of all, like 2 people that have gone through it kind of lead other men through it. And that's 1 week or 1 day out of a week for 12 weeks, or I'm sorry, 12 months. And we get closer and closer. You know, there's a termination because there's 12 steps. Well, obviously, once you get up to step 12, the group terminates. And that was, I mean, we all got a chance to see each other afterwards, so it wasn't so scary. But it was, but we knew the end was coming when we first started it, and the only thing that we felt comfortable because we grew bonds with one another, and grew stronger and closer with one another, and we were just kind of, you know, I guess a little saddened by saying, hey, it's time to, we're going to leave the group. We're no longer going to be meeting once a week. We're going to see each other on Fridays now. And so I get not so much the fear of leaving a group, but just the communal aspect, as Teresa had mentioned.
Okay. So personally for me, I've had 3 therapists. And then for my oldest child, after he was diagnosed with autism, we didn't go to therapy right away because he was 4. But when he turned 5, 6, and he started kindergarten, that's when I started therapy for him. And then one day, how old was he? It was what, like 9 or 10, something like that. I finally terminated therapy for him because I got mad. But with me, the first time that I went to therapy, I was a child. I was like 7 or 8. And I had a lot of issues between me and my mom. So that was part of why we weren't going to therapy. But my mom did all the talking, and it made it sound like I was this horrible child. And then the therapist was like, well, just keep whooping her. There's no point in you being here. And it was things like the things she would complain about were like things that children actually do, and were like minor things, like, oh, her room's not spotless, and she's, you know, she has chores to do, but sometimes she doesn't get them done right away, you know, like really stupid things. So it was like pointless for us to be there. And so for a very long time, I would not go to therapy. I just was so anti-therapy, it was ridiculous. Um, and just, you know, you would have thought I went because of just growing up, seeing the domestic violence, being verbally, mentally, and physically abused my own self as a child, that I would have went. But it took a really long time. And so I did go for a little bit after I got divorced, but I was just like, you know what, this isn't working. So I left because I felt like it was just pointless. And then when I got with TJ, he was like, my sister had passed and he was like pushing me, you need to go to therapy, you need to go to therapy. And I told him, I said, you know, you can't force a person to go to therapy. Like, I need to do it myself. So I finally, like, when I did my soul searching and I just finally like sat down and like was really thinking about things, I was like, okay, it's time for me to go to therapy. So when I went, it was the intention of, you know, working through grief with the loss of my sister, but it ended up working through pretty much like grief over the relationship that I had with my mom and a lot of the things that went on. And, you know, like I said, we're on standby, so I can go back anytime. It's not fully terminated. But even after just working through and sharing with him, you know, some of the things that were going on, he's like, well, it sounds like you're setting healthy boundaries. It sounds like you're really working at this and you're doing really well. He's like, just keep, you know, doing what you're doing. Don't go back on things that you say are not working for you, because then that's when they keep coming back and doing the same thing. So that's where I'm at with my therapy. With my oldest, like I said, I got really upset and I terminated. So we were going to therapy for his behavior. If you're not familiar with children that are autistic and ADHD, it is like being in a tornado half the time. I don't know how else to describe it. Like, when I say behaviors, I don't mean like hitting and like simple things that most kids do and you tell them to stop and they stop. Like, we went through biting. He loved to be bit. He liked to be hit. He liked to be tied up. He liked, I mean, we went through a phase where I told everybody they were not allowed to come in my house wearing shirts that had anything on them. Like, you couldn't wear a shirt that had felt or sequins or like strings dangling from it, because he would walk up to you and he would start running his hands across your chest. And like, you know, because he liked the texture, he, you know, curious, but he wouldn't verbalize it because it was a while before he started talking very well. Because he could only say like 3 words when I got him. We went through where I told people that bags were not allowed in my home. You couldn't even have a backpack, let alone a purse, because he would put them on his head and he would strap them tight and then he would rip it off his head. And it was like this rush of adrenaline from suffocating himself pretty much.
Oh,
So, I mean, when I say we went through behaviors, we did. Like, it was absolutely nuts. Like, every time I got one to stop, a new one developed. So we were going to therapy. The school was complaining, oh, he's too hyperactive. He won't sit still. He won't stop talking. He won't stop touching stuff. He, you know, it was kindergarten was like the tester for how school was going to turn out. Like, it was absolutely nuts. So we did go to therapy and they were like, we suggest maybe a medication. And I, you know, knowing my sister's history with meds and stuff, I was kind of anti on that just because I knew what it could do to you starting as a young child. But I was like, okay, we'll try out a low dose. We'll see how it works. So it was working. We were doing okay. Everything was good for a while as he aged. And then I got upset because I couldn't be at an appointment and I needed somebody else to take him. And they were like, no, you have to be here. Nobody else is allowed. And I was like, well, this is ridiculous. I'm like, I've asked, can I bring other people that are in his life as a support for him to come in for therapy and all that? You guys tell me that they can come, but they're not allowed to speak or say anything because they're not the direct parent. Like, I'm like, how is this benefiting him and helping him if we're not allowed to bring in other supports? I'm like, he has a whole support system, but you won't let us help him the way we want to. Because we were doing We did behavior therapy or behavior coaching. We did family therapy. We were doing everything. And he knew how to play the game. That was the other problem. He knew how to play the game with the therapist. And I was just like, you know what? I'm done. No more. No more medication, no more nothing. So we just, I told my mother-in-law, once his meds are done, that's it. Like, there's nothing else. So last year was the first school year, which was 5th grade, was the first full school year without medication. And I never realized like how crazy it can get when a kid is coming off the meds, because so we had him on a sleep med because he wouldn't sleep. So he was on 0.1 milligrams of Concerta. And then, not Concerta, the other one for sleeping. He was
Ambien?
on, no, oh, what is it called? Always, when the families tell me what it is, I always know what they're talking about, but I can't remember what it's called right now.
Trazodone?
No, it's similar to Ambien and Trazodone. But he was on the Concerta to control the ADHD, and I realized that it wasn't controlling the ADHD, it was actually controlling his stimming from the autism, because he wasn't flapping or chewing things, and he wasn't like skimming the furniture as much as he used to. You could still see it, but it wasn't as prevalent. But then when we took him off, that came back full force, and then the teachers were complaining, and she's like, well, he's ADHD and my boys. And I was thinking to myself, you have no idea, because he's actually got 2 diagnoses, not just one. You guys are only seeing the one, but you're not realizing that one is actually overpowering the other. But we made it through the year, and I did. I terminated it. I thought about going back. And I sat down and I had a serious talk with him about it. I said, I was like, Jaden, everybody's saying you need to be on meds and we need to go back to therapy. We need to do this. I said, but it's directly affecting you. You are the individual, you have to be there. I want to really sit and speak to you about this, because I want you to understand like how your behaviors are really affect others. And we're still continuously talking about it, but he freaked out. He flipped out. He was like, I don't want to go back. I don't want the meds. I don't, he didn't want it. And I told him, he's an individual. He's a person. He might be young, but I'm not going to force him. He has his own rights too as a person. And it's not fair to him to force him to do something that he does not want to do, because he's growing and we're trying to control this one thing. I'm like, so it's not about what you guys want. You guys need to learn to work with him as he is. I said, I've learned to work with him. I know how to work with him. I've been trying to show you and teach you. Now it's your guys' turn to really, truly learn how to work with him. He's, how old is he now? He'll be 12 next year. This is the 2nd year of school with no meds. We did the melatonin. We've tried it all. I'm like, stop wasting your money on the over-the-counter. It's not working. Learn to work with him. He's always going to talk. He's always going to flap. He's got sensory issues. Some of the things you see him doing, he's always going to do. And so we don't go back to therapy anymore for him. And he's fine. He's okay with it. So for that one, yeah, it was a lot of anger, because I just felt like I wasted my time. So, I don't know if anybody's ever, like Lindsay, I know with CPS you had to do some stuff. So I don't know if you've ever sat in on a CFT with behavioral health and some of the kiddos that you've had to work with. And those can be.
I never worked with children because I don't think I could. But I'm not even trying to be funny about it. I just don't think it's for me. For that reason, I wouldn't. I don't have children, so I couldn't even imagine how pissed off my clients or parents would be if I were, because I don't think I have the patience for it. I really don't. So I can understand your frustration, because I think it takes a really special kind of person to be able to do that, and I'm not it. I don't feel.
Okay. Well, no, that's understandable, because trust me, I work with a lady that doesn't like kids, and I'm like, how are you working this job and you don't like kids?
Yeah, it's I
Career.
like CPS is different just because it was more investigative. So like I didn't have a lot of interaction with like children. I know how to talk to them, but like you get somebody who doesn't want to talk to you, and like I mean, so when I did work on the child and adolescent unit in the mental health program, I mean, we had to deal with angry parents all the time because they weren't in charge of like their treatment, and we had to do what worked. And if you're bringing your child into, I worked at Pine Rest, if you're bringing your child into Pine Rest, you kind of have to trust them.
Mhm.
But honest to God, like I think people thought when they were entering a mental health hospital that they would be getting more one-on-one time with psychiatrists, and that's not at all how it worked. If anything, us as psych techs would speak more frequently with the patients than the psychiatrist. There was one that would come in, talk to him for 5 minutes, and that was it. And I mean, it's just not
Not enough time.
not sad to say goodbye at all. And like some of them wouldn't come back because of that, and it's sad. I think at least in Michigan, there's a serious disconnect with mental health hospitals versus like if you're going to therapy. You don't get that one-on-one therapy. Like, bless you.
Thank you. Sorry.
No, you're fine. You don't get that one-on-one therapy in the hospital that you do elsewhere, you know, and you kind of expect it. So like it's tough to have somebody trust a therapist on the outside when we suggest, well, you should continue therapy, and they're like, I don't want to get therapy if this is how it is, you know. So
Yeah.
there's not even a chance to say goodbye. You know, I mean, we just kind of give them the advice, and then they use their experience in the hospital as like a guide, and it's really sad because it's not like that, and I get really mad about it.
Yeah, I work with, we do CFT meetings. I get invited to them. I only like to do the ones that are like truly serious and not the minor ones, just because some of the, like I had a child, I didn't even know why he was still in our unit. He should have been in the behavioral health unit with DDD over here.
Mm-hmm.
He was not just a harm to himself, but to his own family and others. Like they slept with the doors padlocked. Like he had a chime on his bedroom door so they knew when he was out about in the house. He was not allowed to have access to knives or anything. Like that's how bad it was. He wasn't even allowed to be alone with his nieces that were just born.
Wow.
He, you know, police involvement and things like that. And I had to fight for the behavioral health agency to truly like realize that this kid is not, you know, it's not a fluffy bunny. Like, come on, guys, seriously, he really needs some help. Not just the medication, stop upping the medication. Like, he needs some additional therapy. They need some additional supports. Like, we, you know, so pushing behavioral health is kind of hard sometimes with counseling because they don't, I guess they don't see it as serious as somebody else that's working with them in a different point of view and in direct contact with the families a whole lot more often than they are.
Mm-hmm.
So it does make it, you know, when I hear the family say, well, we terminated our you know, our therapy with this agency, I'm like, okay, but we only have so many select agencies, so you can't terminate with everybody because then you're kind of left with nothing. We got to find one that is going to work and, you know, kind of stick with it. Try to make it work or ask them for a different provider, but don't just leave. And that's something that I see a lot, especially, you know, with children. Some of them are adults. Some of them are adults. And even with some of the adults, it's the same thing. They're like, I'm not happy with this one, so I left and went to this one, and I'm still not happy. I'm like, guys, we don't have very many. We have, you know, Magellan and JFCS and stuff, but you can't keep terminating. We got to find the common denominator on why you're terminating to kind of figure out how to make it work. And sometimes they will sit down and do it. Sometimes they won't.
A lot of the time it has to do with insurance companies too. Like for us at Pine Rest, when their insurance was up, their stay was up.
Yeah.
So,
That's how it was at the skilled nursing facility I worked at.
is that the Coronado place you were talking about?
Mhm.
Yeah. Yeah. And it was sad because a lot of the time patients would express to us, I'm not ready to leave. Like, I'm still, like, some of it was a personality disorder and they wanted attention. Like, and I understood that, but some of it was real. And some of it was like, if you discharge these people, like, they're not getting the help they need. And so they're expressing that they're not ready to leave. And it's tough for me to be like, well, that's the, you know what I
Yeah.
mean? It's like you have no control and it's really tough. And we had a patient I got really close to, and the doctor was going to discharge him, and he was a dick. The doctor was. And I said to one of the nurses, I said, if you discharge him, he's going to kill himself. And he did 2 weeks later.
Wow.
He killed himself. And I found out from the nurse that I had told that to, told me. And I was devastated. It was the first time I'd ever dealt with something like that too. And I know it happens more often than I probably know about, especially working there, but it really affected me. First patient I got close to, first patient that I had that happen to, and I knew it was going to happen, and there was nothing I could do.
Yeah.
And I had posted something on Facebook about suicide awareness, and he tried to reach out, and that I'll lose my job. And I had to block him, and he killed himself 2 days later. And it just, the guilt ate me alive. It was just too much. And I had gotten close with his family, and his brother was a psychiatrist, and like it took everything I had not to go off on that psychiatrist that worked at there, because I'm just like, I'm saying that this kid is going to kill himself if he wasn't a kid, but 22, kid to me. And this kid is going to kill himself if you discharge him. I'm telling you. He did. And it broke my heart. And I know there's only so much we can do in that situation, and but there's only so much we can do if people will find a way. But when you're terminating basically a therapeutic stay before the patient is ready, and your staff's telling you this guy is gonna kill himself, and you still discharge him, I thought, what's the point? I really questioned mental health at that point, and I was still in my undergrad. But it was tough because I promised myself, no matter what, if and when I became a therapist or become a therapist, I will always pay attention to the signs, and I will always read between the lines, and I will always listen, because I don't want to be the reason or contribute to the reason that somebody does that.
No, that's understandable. I had a dad recently. I went to go do my visit, and he, like the first 45 minutes was about him, like, just listening to him. And we have a girl right that says, well, I'm not a therapist, so I don't have time for them. I don't care what the parent has to say about themselves. But they don't realize that sometimes there's details within what they're sharing. And this dad, he's like, well, I go to therapy, but I still, it's like a Band-Aid right now. I do feel suicidal, and I do want to kill myself, but it's like a Band-Aid. So right now I'm fine because I have to provide for my child. But other than that, that's where I'm at. He's like, it's like a roller coaster ride. And he put it in a term that I never thought of, because he's like, it's like a roller coaster ride. You're on the ride, you're enjoying yourself, ooh, it's fun. And then when it's done, then that's